Good morning. Welcome to Curbside Consult. Thanks so much for talking to me. Maybe we should start with you introducing yourself, and then we'll go at it.
Hi, I'm Joanne Kenen, and I am the healthcare editor of Politico and Politico Pro, and I've been covering healthcare for an awful long time.
And just for some of our viewers won't know the difference between Politico and Politico Pro, although of course they've heard about Politico. Can you just describe that for a moment?
Our reporters write some more incremental coverage for a more professional health policy audience. And it's a subscription service, and then we jump out of that paywall and we're the health reporters, the extremely busy health reporters for Politico.
Anything that is a successful economic model for good reporting is something that I think is fantastic. So,
you think it's good reporting?
Yeah. Oh, you guys are doing a lot of the best reporting that's out there. And now, what were you doing before Politico?
I did a lot of things. I was a congressional reporter for Reuters for many years, and that included the healthcare beat in the Hill. And if you sit through enough Senate Finance Committee hearings, you really end up learning a lot of health policy. And then I was a Kaiser Family Foundation media fellow. I had a year to just really write in depth about aging, end-of-life palliative care, which was one of the great professional experiences I've ever had, which I'm grateful for. And I worked at a think tank for a few years. I worked at the New America Foundation, where I was a sort of in-house health policy writer during the passage of reform. And I've written for pretty much anybody else you can think of before coming to Politico.
By the way, your background described one thing that's striking about your background. There's a part that I find very heartening, and there's a part that concerns me when we think about other issues beyond health, which is that you are a product of an ecosystem that actually nurtured you in a lot of ways to develop the expertise that you have. And a lot of people in the health beat actually have had foundation support and have had been involved with Kaiser or Robert Wood Johnson and so on. When I think about some issue like climate change, there's not the same support for sort of.
There's more. I mean, I have friends who are working in climate change, and there is a lot more. I'm not as familiar with that world, but yeah, they're getting fellowships, and there's organization, like I'm very involved with the Association of Healthcare Journalists, where I am not only gaining more knowledge, but I'm also, in a somewhat mentoring capacity to younger journalists. But I think in the climate world, that is also growing. There are increasing sort of professional development, and also, you learn on the beat. I mean, before Kaiser, before I had that year, you do your job for a place like Reuters. I mean, Reuters, I really was on the Hill and I learned healthcare. I learned a lot about healthcare. So, I was plunked into it. I actually spent part of my life covering politics pre-kids, and I also spent part of my life in Latin America. So you just end up where you end up, and if you like it, you can learn about it.
That's great. Well, again, welcome to Curbside Consult. I'm Harold Pollack, talking to Joanne Kenen, who is the sort of impresario of health policy coverage at Politico and Politico Pro. Is that a fair statement?
That might be one way. I think the 6 reporters who work for me might have other ways of describing.
There you go. So what's up? So getting a couple questions about ACA. So one is, people have often heard that ACA is kind of going national, the model that was implemented in Massachusetts in 2006 under Governor Romney and Democrats in the legislature. How does the ACA rollout compare to what was happening in Massachusetts?
I think the salient, huge, biggest difference is that in Massachusetts it was bipartisan, and in the rest of the country it is as partisan, as way more partisan than we imagined in 2009, 2010. I mean, the usual pattern is people yell and scream, a bill gets passed. It doesn't totally go away. I mean, there are people who are still fighting about Social Security, but this one, the intensity just keeps getting more and more, and it'll die down for a while and then it roars back. So in a more traditional implementation, once there's more bipartisan cooperation. I mean, Medicare Part D, Massachusetts, it's not that everybody loves everything, but there's not this kind of just unrelenting intensity. So, that's the big deal in Massachusetts. They work together. There were glitches. But the other thing is that, they have glitches, but this is like, the mother of all glitch.
Mm-hmm.
It's not comparable. There are analogies to the Medicare rollout, but I still think this is worse than that even. And that was.
So, by the way, just this, we'll talk about the performance issues in a minute, but it seems to me that it's almost inevitable that this is the centerpiece achievement of a president who kind of exemplifies tremendous demographic and political change in the country. And it seems almost uh, it's not surprising to me that it's become so polarized, because the very fact that the Democrats could do it by themselves exemplifies for millions of Americans a very frightening change in our political system, which which both ACA is both a huge substantive thing, but it's also symbolically a real watershed in the country in a lot of ways. And so I'm not. The only thing that I feel is a glimmer of hope of bipartisanship is that the president and Republican governors have a relationship which is very different from the relationship between the president and Republicans in Washington.
Yes, I mean there is, but there's not a partner the way Romney had Ted Kennedy as a partner in Massachusetts when Romney was governor and Ted Kennedy was a senator. Did they agree on everything? No. Did they find common ground? Yeah, they found pretty amazing common ground. It wasn't as complicated. They weren't changing, a sixth of the economy in a supercharged political environment, and they had fewer uninsured people to begin with in Massachusetts. There are governors who are partnering up to a point on Medicaid. There aren't many governors who say, I really like this law. In fact, there are no Republican governors who said that. There are a handful, Susana Martinez in New Mexico, Sandoval in Nevada, who are pushing ahead with quite a bit of it, despite the fact that Snyder, Michigan, is doing a fair amount as well. But they're not saying, hey, I really love this thing. But there are sort of germs of partnership at the state level.
It sounds like maybe when President Obama leaves office, it will be easier for some of these bipartisan relationships to develop, because it just won't be about the centerpiece of your adversary's presidency.
Yes and no. I mean, it really depends on how things play out over the next 6 months to a year of what it looks like in a year and what there is to play out. I mean, the 2014. On one hand, the Senate is definitely up for grabs in 2014. That could really affect how the law plays out. But we live in such a fast-paced political environment. I mean, the shutdown, which was all about Obamacare. It was what, 2 weeks ago? Doesn't it seem like 20 years? I mean, I have no idea what we're going to be, the dominant issues on healthcare. And if people start signing up, if the website starts working, the narrative changes again, and it can change very fast.
So, again, this is Curbside Consult. I'm Harold Pollack talking to Joanne Kenen. Now, let's talk about some of the performance issues in healthcare.gov. Now, you mentioned that Medicare Part D had glitches, but this is sort of qualitatively worse.
Yeah.
How do you say more about that?
Well, the Democrats are really pointing to this a lot because there were a lot of bad headlines when Medicare Part D rolled out, and it was passed in 2003. The sort of implementation stage was 2005, and the benefit went into effect in 2006. And there were sign-up problems, there were computer problems, there were delays. There were then, I think many people remember those first few weeks in January when people tried to go to their drugstore and get something, but they didn't have the right card or they weren't on the list. That's one reason they cut off. They aimed at a December 15th sign-up cutoff for January 1st coverage, because if you let someone do it like at 11 o'clock on December 31st and they try to go to the doctor on January 1st, you need a little bit of time to process those things. But it wasn't. And one of the things I also really remember was the huge choice of plans and how much that confused seniors. I mean, one of the most memorable times from that moment, and maybe your listeners remember this, is Julie Rovner, who was my friend and colleague at NPR, and her mom, who was also a very former healthcare journalist, very sophisticated. I remember a piece Julie ran on I don't remember how many hours. Just the hours it took the two of them to get her mom signed up. We're not hearing so much about confusion about your choices. You just can't get on the website.
Yeah.
And say, okay, well, you use paper, you use a telephone. The people on the other end of the paper and the telephone have to then get on the website to finish the process. people are just not getting through at the rate they need to get through. And that, again, plays into the political dynamic because you've got unhappy people in the headlines with the cancel plans and everything else. And you can't get the happy ones until they can sign up. Medicare, it was, it wasn't as much out of pocket, and you weren't giving something up. Either you didn't have coverage and you were getting it, or you weren't changing. You didn't have a mandate. I mean, there were some subtle penalties, but nothing like this. And again, the Democrats, it was partisan, but it wasn't this partisan. Don't forget there were cross-party votes on that.
One of the ironies, by the way, is many of the unpopular elements of ACA are things that were done to make it financially sustainable and self-financing. And Part D, they didn't do that. And in fact, its unfunded liabilities are quite large, and
less than they were anticipated, which is interesting because the Republicans say, and there are plenty of reasons historically in terms of estimates being too low. I mean, everything in general, things do cost more than we think they are over time. But so the Republicans say, no, we don't really trust these numbers. I mean, some of the Republican opposition is traditionally economic concerned. It's not all Tea Party ideology. I mean, some of it is just Republicans, fiscally conservative Republicans say, I don't trust the numbers. I think this is going to cost a lot more than they're telling us, and the country can't afford it. The interesting thing about Medicare D, the drug benefit, is it actually came in under the forecast because there was a lot of controversy with two sets of forecasts, and it was going to be this disaster. It's actually Democrats who voted against it admit that it's working better than they thought, that it's coming in. Both sides, there's a fact. It is cheaper than thought. I mean, that's not a dispute. We have the bill. And but that, if you look at the early estimates of Medicare and Medicaid, we're spending a lot more than people thought at the time.